Thank you, sir.
My name is Richard Mackowiak of 7 Stone Mill Lane, Eastford, Connecticut, and I'm representing myself, and I'm here today to tell my story about how difficult it is to get individual health insurance, and I'm here today to support HB 6305. Since 1985, I've lived in Connecticut as a self-employed hydroelectric engineer, and I purchased individual health insurance for my family of 3. It would be myself, I'm 56 years old, my wife of 54, and my son is 19. Our annual premiums are $19,000, and we have a $5,000 deductible. And we're relatively healthy. Our annual medical expenses are around $5,000, so our deductible pays for everything. We don't cost the insurance company anything. And those expenses are routine treatments: colonoscopies, mammograms, annual physicals, a few prescriptions. And our premiums increase 25% a year. I expect an increase in March. It's going to go up probably 25%. That means I'm going to pay $29,000 a year for insurance. We continually reapply for new coverage, but we get rejected and denied for pre-existing conditions. I want to tell you about some of the pre-existing conditions. I was denied coverage for a condition called Raynaud's. In 2006, I went to my doctor in the wintertime, and I said, "Gee, doc, my fingers get cold, colder than they used to when I was younger." And he said, "Well, gee, maybe it's Raynaud's, maybe it's something else." Didn't prescribe any medication. There's nothing I have to do. I don't even remember what hand it was on. But because of that, I get denied health insurance. Another example, my wife Claire, she has fibromyalgia, and she does take a medication for that, but it's under control. We applied for insurance. Somebody else denied us. And we asked our doctor to write a letter to say something like, "It's under control." He did that. We were still denied. I didn't want to give up because those people had already approved me. They overlooked my Raynaud's condition. So I called the underwriters and I asked for an explanation. So what the person did was she used an analogy to explain their position. This is what she told me. If you had a car with a bad transmission and tried to purchase an extended warranty, you would be denied. So, like that old car with a bad transmission, we denied your wife's application. I was furious. But that's the type of thing I run into every time I try to get new insurance. So, we desperately need a change. We desperately need health insurance. So please help.
Thank you, sir. I appreciate that. Before you run off, the federal health care law no longer would deny you health coverage if you have a pre-existing condition. Now, have you checked recently? Because I don't remember if when you asked for health care, your plan to be renewed or whatever it was last March. I don't know whether that's your anniversary month and whether you have to wait till this March.
Those most recent denials were in October and November of 2010. From my understanding, that health care, what you just referred to, took effect September 23rd. So they denied me after that. I'm not sure about all of the dates. However, I still have a few years before I'm able to take advantage of that no denial for pre-existing condition feature. It's still not working. If I were to apply today, I would be denied.
Have you contacted your congressman to ask, since it's a federal law that I'm questioning, to see if they could help in any way?
I haven't done that specifically, but I work with I will do that.
Yeah, only, as I said, only because we're talking about the new federal health care changes, not state. I mean, obviously, the costs that you are incurring for health care are extraordinary. I know in my small business, it costs us about $17,000 a year to insure a family, and we're supposedly in a group plan. So I'm amazed that I understand the hardship.
Yes, okay.
So.
Thank you.
Anyone else? Yes, Representative Carter.
Thank you, Madam Chair, and thank you for being here and staying late. I'm kind of curious, when you were talking about being denied, were you denied entirely from the plan, or were you denied from a more a cheaper plan? They say no coverage at all, or just you were trying to get a better cost, and they denied you from that?
For example, one of those applications that I did in October of 2010 for the three of us family members, I was approved. My son of 19 was approved. My wife was denied because of fibromyalgia.
Okay.
And there was just no way. They, for no price would they have accepted us as clients.
That's my question. Okay.
And then another applicant or another company did something similar where I was denied for some reason, as well as my wife, but they were willing to take my 19-year-old son.
Okay. And as they mentioned before, look into it now. Some things have changed, and hopefully you have some luck.
And as many times as I've looked into it, I'm just looking at having Sustanet take effect. I know there was a time that they said it might be here in July of 2012 for individuals. Some of the things I heard here made it sound like it might be later than that, but I wish you could do it tomorrow. So please hurry.
Thank you very much. Thank you, and good luck to you and your family as well. Thank you.